Hi, my name is Lindsay, and I'm a master's student in the Communication Disorders program at the University of Texas at Dallas. I chose the field of speech language pathology because I've always wanted to work in a situation where I'm helping people in a one-on-one therapy relationship. I am also excited about the idea that you can really measure the progress that you make with your clients. It's not something abstract. You can really tell if you're making a difference in their lives. And of course, the field is just wonderful in general. It consistently makes lists of growing fields just in our country. The job opportunities are plentiful. You make a good salary. And I love that you can work with any population in any situation at any point in your career. So even though I'm interested in pediatrics now, if I 10 years down the road decide I want to work with adults, I'll be able to do that once I'm licensed. In terms of what kind of classes you take in a master's program to become a speech language pathologist, it differs based on your program. My program, for example, is 5 semesters long. We have some core classes that we have to take, and those are things like dysphagia, stuttering, neurogenic communication disorders, voice disorders, motor speech disorders, things like that give you a really good overview of the whole field. But my program is big enough that we also get to choose a lot of electives. Now, since I'm interested in pediatrics, I'll be taking classes in things like autism, preschool intervention. I'm actually also going to take a class in augmentative communication, which I'm really excited about. And there's just a huge variety of things that I will be able to do in order to tailor my degree a little bit more to my interests. But the good news is no matter your program, even if your entire schedule is set, you're going to get a well-rounded education. It's all regulated by ASHA. You'll be fine. Another part of my program is practicum. Now the way it works for us, we take our classes in the afternoon, but in the mornings we have practicum, which is you get a client and you're doing therapy with them. And I would recommend getting as wide a variety of experiences as you can. So far, I've only been in school for 2 semesters, but I've had a child as a client, and I've also had an adult. And it's just such a great experience, and it's really scary, but it's so helpful, and you learn so much, and it's the best way to learn. You just get to keep being creative and learning from your peers and your supervisors, and it's fantastic. My absolute favorite thing about the field of speech language pathology and communication disorders is that you are just constantly learning something new, and it won't stop once you're out of grad school. You're going to keep learning for the rest of your life because the scope of the field is huge, and you're dealing with human beings, and every human being is different too. So you really have to be creative in your therapy and in the way you approach the problems that your clients have. And I just love how much I learn every day coming here, and I can't wait for that to continue. It's a blast. My least favorite part of pursuing this career is sort of related to my favorite part. Because you're learning so much and because you have all these experiences, sometimes it can get a little overwhelming. There are days where I feel like between the test I have today, the test I have tomorrow, the project that's due next week, plus preparing for therapy in the next 30 minutes, it's a lot to handle. But it's totally manageable. Every one of your peers is going through it too. You can commiserate. And I doubt you're going to find many graduate programs where you don't get that kind of experience. But it's good, and it helps prepare you. Before entering this graduate program, if I could have had somebody explain anything to me, it would have been that within the first 2 weeks of grad school, I was going to have my first client. I did not realize that coming in, and it was a little bit intimidating. And your first few weeks of therapy with them, you will feel like you're totally lost. You don't know what you're doing. It's really scary. And honestly, you're not going to be very good at it at first, but that's why we're all here. And you just got to rely on your supervisors and your friends and on your own creativity and your imagination and everything you're studying in school, and just keep asking questions, keep trying harder. Just keep doing everything you can to give your client the most help that you can. As far as any advice goes for people who are interested in speech language pathology, I have a couple of pointers for you. One would be do your research. If you are interested in this field, there are so many resources out there to help you really decide. I mean, you can just look it up on YouTube. You can find videos of people giving therapy and look at that and see if that's something you're interested in. I also called around clinics in my area, and actually the first phone call, the clinic I spoke with was more than happy to have me come in and observe, and I actually became a weekly volunteer there, and that was great exposure. And chances are you know somebody who is a speech language pathologist. And even if you don't know somebody, somebody you knows somebody. So there are people out there, and they are probably very happy to talk to you, because generally people in this field, we like other people. I would also say to be really diligent in the application process. Getting into grad school is definitely competitive, but it's doable. Just make sure that you have the best packet that you can possibly have between letters of recommendation, your statement of purpose, and your GRE scores. I know the GRE is terrible, and some programs don't require it. Mine does. I had to take that test twice before I got a score I was happy with, but that's just what you have to do. I would also say that if you are currently not a communication disorder student, don't let that discourage you. I have a bachelor's degree in psychology, and I didn't decide that I wanted to be a speech language pathologist until months after I graduated college. And I have met so many people with similar stories. You will be surrounded by people whose undergraduate degree is not in this field, and that's okay. I know several people who have been working for 5 years and then they come back to it. It's just everyone has a different experience with this. And finally, my advice is to get excited. This field is full of passionate people. And it's hard not to get excited about it because everyone just loves what they do. Communication is such an important part of the human experience. And helping somebody who either can't communicate effectively, or especially if they used to be able to communicate and now they can't, being able to help them is so rewarding and so important. So it's a great field, and I hope you consider it.